State leaders are bringing in a third-party expert to conduct an independent safety assessment at the Minnesota State Capitol.
It follows the shootings of two lawmakers and their spouses last month, as well as multiple breaches of security on Capitol grounds by a man just this weekend. That suspect, 36-year-old Dominic Peace, is now facing a burglary charge. Responding officers described him as someone who may have been experiencing a mental health crisis.
Ellen Gallus is looking into that part of the story for us, and she joins us live from the State Capitol. Ellen?
That's right. Now, there are plenty of questions surrounding security at the Capitol tonight, but there are also questions surrounding that suspect now charged with burglary and his mental state of mind at the time of the incident. One expert tells me it can be difficult to help and intervene. The officers who encountered 36-year-old Dominic Peace at the Capitol Friday described someone who was confused and delusional. In charges filed Tuesday, investigators say Peace was first seen on security camera footage at 2 p.m., carrying a wooden wedge to prop the door open later that night. When they found Peace at 11:15 Friday night, they described him as an emotionally disturbed person. They found him naked, seated in the Senate president's chair. He told officers the Capitol was his house. Over the course of the weekend, Peace was taken to Regents Hospital for a mental health evaluation twice and was released twice.
Well, first, I was glad that they didn't initially take him to jail. You know, clearly he was exhibiting signs of a mental illness heading towards a crisis. And so the fact that they actually brought him to a hospital versus immediately bringing him to jail was absolutely the right thing.
Sue Abderholden is the executive director of NAMI, the National Alliance on Mental Health. She says it can be hard to help patients with mental health challenges if they're not considered dangerous or if they're not asking for or agreeing to help. How could somebody be released twice in a 24-hour period?
He wasn't a danger to himself or others. You know, it clearly, you know, from what I can tell, he was not suicidal. He was not armed in any way. He was not threatening. He was just wanting to get into the state capitol for some reason.
What is the standard of care then, or is there a standard of care for patients like this, in situations like this?
Since he's not able to be committed, perhaps the crisis team could have been involved to try to, again, engage him in treatment, getting him into a crisis home or something like that.
Now, she also says the system needs to do a better job of engaging with patients over time and helping them realize how treatment could help. Reporting live at the Capitol, Ellen Gallus, 5 Eyewitness News.